We're delighted again to welcome Lydia Dunford back. And Lydia has been kind enough to do lots of our webinars, and they're always extremely popular. This is the most popular one so far. And I will let Lydia introduce herself and tell you about what she's going to be talking about today. And I will be asking Lydia various questions and she'll be answering them. And as I say, please do put your own questions into the chat, and we'll answer as many as possible, either as we go along or towards the end of the session. So thank you, Lydia, and over to you.
Thank you, Sally. It's always nice to be back doing these webinars. Please let me know if you can't hear me or need me to repeat anything or clarify anything. I will do my best in the time. I've put my email address in the chat function already. So if there's any comments, questions, follow-ups that I can't cover today for you, then please contact me afterwards for a free initial chat. I'd be happy to do that. So my name's Lydia. I'm one of the SCN solicitors at Boys Turner, and we specialise in advising parents and carers of children and young people who have special educational needs and disabilities, specifically around the EHCP process.
So our first question, what is an Education, Health and Care Needs Assessment, or EHCNA?
So this is the first step in the EHCP process. EHCPs are education, health and care plans. Before you get to an EHC plan, there has to have been one of these EHC needs assessments. It's a holistic assessment of a child or young person, either from age 0 up until 25, of their education, their health and their care needs. It's undertaken by their local authority where they live, and it involves a number of professionals and people within the remits of education, health and care, which will be discussed in one of the later questions, I believe. Like I said, it's the first step towards getting an EHC plan. The aim of the assessment is to establish the extent of that child or young person's needs across those 3 areas, and what level, what type of provision they need to have those needs met, essentially.
And who can request an EHCNA?
There are a couple of different people who can. The child or the young person's parents can. The young person themselves, so that's someone over the age of 16, or someone on their behalf if the young person is held to lack the mental capacity to do so. There's a general presumption that a young person has mental capacity to carry out a function, unless it's proven otherwise. It could also be someone on behalf of the child or young person's school. That's not uncommon, actually, to have someone from a school making the request as well. It's also worth noting that professionals who are involved with the child or young person, which could be foster carers, healthcare or social care professionals, early years practitioners, they could also notify the local authority about the child or young person. It's not the same as making the request directly, but they could bring it to their attention, particularly if that professional, whoever's involved with the child or young person, thinks that actually this assessment might be necessary for them.
What evidence do I need if considering requesting an EHCNA?
Okay, so there's a couple of things to think about here. You've first got to think about, well, what does the local authority have to be satisfied is evidence in order to go ahead with an assessment in the first place? It's a fairly broad, fairly low threshold rather, to show. It's essentially showing that the child or young person may have special educational needs, and that can be quite a broad range of needs across 4 areas. It covers cognition and learning, communication and interaction, social, emotional, mental health, and sensory and physical, and also looking at independence as well, preparing for adulthood, particularly as young people are going towards adulthood, sort of post year 9 age as well. So that's the first step. They may have needs across one or some of those areas, and that they may therefore need an EHC plan. So it's quite vague potentially. There's a lot of scope to put arguments forward to say how that might have been met. It's not a definite. It's not saying they definitely have needs. It's not saying that they definitely need an EHC plan. It's just may. We sometimes find that local authorities can apply a higher threshold to this stage and sometimes say, well, there's no evidence that they definitely need an EHC plan. Well, that's not what the law requires at this point. It's simply they may do. So those are the 2 points you need to try and put forward. When you're thinking about what evidence needs to be considered, it's also worth noting what the SCN Code of Practice says. This is a really helpful free resource. You can search for it on the government website. It's a good companion guide to what the legislation says about SCN and EHCPs. It gives a very handy example checklist of what local authorities should consider if they're looking at a request for an EHC needs assessment. So they'll look at evidence of the child or young person's academic attainment, their rate of progress, the extent of their needs. They'll also look at what evidence is there of support already being provided by the placement, other professionals involved. Has there been progress made, but is that only as a result of additional support that wouldn't normally be available or provided? Evidence of health needs, physical, emotional needs and development. And if there's a young person over 18, the local authority should also be considering, well, does that young person need additional time compared to their peers who don't have their needs to complete their educational training? So that's what a local authority would need to be thinking about. What parents or young persons should put forward really does depend on the individual circumstances. There's no formal requirement for anything in terms of evidence or what should or shouldn't be sent. But we found generally that it's worth sending what's available and what's relevant in terms of any school reports to show the progress and provision already in place, any therapy reports. There might be professionals already involved with the child or young person, or they may have assessed at a previous time, any medical reports. We would also generally say keep them from about 2 or 3 years, otherwise they start getting quite out of date. The exception for this is usually diagnosis reports, which can be when a child or young person is younger. But if you want to show that they have a diagnosed need, then that's absolutely fine. Some local authorities will also ask parents to complete a kind of a set form, an application form for this request for an assessment. That's fine. There's no legal requirement for parents to do this, but it's fine if parents do. But what we've often found is it's not sufficient on these forms to put everything you want, because there's often paper evidence, other reports, often a formal written request as well, which is something we help parents with a lot, addressing the legal thresholds and saying what evidence there is, how does this show that the child may have SEN and may need an EHC plan. So it's often a bulk load of information that can be sent in to the local authority, but always focusing on the legal tests and the fact that it's a may, it's not a definite for either requirement at all.
So what information advice must the local authority gather during an EHCNA? Okay,
so if the local authority has, first of all, got your request, they've got their form that's completed, a written, say a formal request as well to go alongside that, and any paper evidence. If they've decided to do an assessment, I should also add actually that once you send the request in, the local authority has to tell you within 6 weeks if they're going to do an assessment or not. I think the final question touches upon what your options are if they don't agree to assess, but 6 weeks is your timescale. So if you make a request and the local authority doesn't come back to you within 6 weeks, you should chase that up. If they come back and they say they're going to assess, and that's great, it's then important to know who they have to get advice and information from, so that you as the parent or as a young person know that there's nothing missed, and also to know what options are available for you to ask for information as well. So the local authority has to get information from the parents of the child or young person, or the young person themselves. That's really important. Their voice is meant to be centred to this process. It's meant to be a tell us once approach. There's lots of very kind of positive sort of messages in the code of practice about how it's meant to be this collaborative process. Often parents don't always find that's the case, but they still need to get advice from parents and the young person, get their views. They need to get educational advice. So this is normally from the head teacher or principal of the school, the early years setting, the college that the child or young person is at. Medical advice as well. So that would be from a healthcare professional. It's usually a paediatrician. Also psychological advice. So this would be from an educational psychologist. Social care. This is one where the local authority is required to get advice and information from social care, but very often, and people may have come across this before, social care response will be a very short statement saying the child or young person is not known. That's it. That's not the same thing as getting advice and information about any social care needs, because it's an education, health and care needs assessment. It is meant to cover these three areas. So if you do get a response like that, then you should go back to the local authority, particularly if you feel your child may have social care needs. And social care needs, it's not the same thing as saying that a child needs to go into care or is under the care of the local authority. Social care, children may have social care needs, and often there can be an overlap with education as well, depending on what their needs are. So if you think there's gaps there, then you should go back to the local authority. I touched upon this briefly, but when a child or young person is going into year 9, local authority needs to also be looking at information about preparing them for adulthood and independent living. That's really key then, because if they do get an EHC plan, that is then written into their plan about outcomes for them to achieve by the time they get to adulthood. This is one which is very important to know for parents and young people, is that if they reasonably request that the local authority gets information from someone in additional to the set list, then the local authority needs to do so. So this could be that there are other professionals already involved. There might be a speech and language therapist, occupational therapist, physiotherapist, it could be anyone. They may already be working with the young person or the child, or they may be on wait list for an assessment, or the school or college may have picked up on there being a need. So if that request is put forward and is reasonable, based on the child's needs, then that's someone else the local authority should get information and advice from. And then finally, if the child or young person has a visual or hearing impairment, then there also needs to be advice from a suitably qualified person in that respect, so a teacher of the deaf, visually impaired. It's also worth noting that if any of the advice from that list of people already exists, and the professional who provided it, the parents or young person and the local authority are happy that that is sufficient for an assessment purpose, then there's no need to duplicate that. So it's worth bearing in mind if there's any available information from an educational psychologist. Sometimes parents come to us and they've already got an educational psychologist who has assessed their child not too long ago. It may then not be necessary for the local authority to also get advice from an educational psychologist if that's going to duplicate it. So it's a fairly comprehensive list. It's important that the information is provided is detailed, it's clear. You're ultimately preempting that this information is going to go into an EHC plan, and quite often we will see it where an assessment is carried out, this information is gathered, a plan is then prepared, and it is effectively copied and pasted into an EHC plan. So if it's not clear and detailed in the assessment phase, it's not going to be when it goes into a plan, and that's when it really matters, because that's then legally binding on the local authority. So it's important to check what the local authority comes back with during these assessments. And I should also add, it doesn't prevent parents from getting their own advice as well from experts. Sometimes that is what parents choose to do. They may say, well, we'll instruct a speech and language therapist or an occupational therapist, for example, if the local authority won't do it, or we've already got someone involved. But remember that the onus is on the local authority to do this assessment. So put the request to them, know who they need to get that advice from. But there is always options for parents to get additional advice going through the process if they feel that's appropriate and necessary.
So our last question, what options are there if a local authority does not agree to carry out an EHCNA?
Yes, so local authorities can and do say no to these assessments, even though it's a fairly low legal threshold to kind of evidence to them. So as I said in the previous question, you do have options if the local authority says no. If they come back to you within the 6 weeks or a bit after 6 weeks, and they say no, they need to give reasons for that. First of all, they need to give you an actual decision letter. So, telling you over the phone, that's not sufficient. It has to be in writing, an official letter, because that then gives you the option to appeal. So either the parent or the young person. An appeal would go to the independent SCND tribunal, so separate from the local authority. It's important you assess the reasons why the local authority has said no. Like I said earlier, often local authorities won't apply the right tests at this stage. They'll jump ahead one. So they'll talk about whether a plan is needed at all. There's no evidence they don't need a plan. Well, that's not what you need to evidence here. It's just they may need a plan. So it's always worth checking that. So parents have the right of appeal. You would have 2 months from the date of that decision letter in which to have contacted mediation. You need to show that you've at least considered mediation with the local authority. Mediation can be sometimes a good option for this stage, especially if there is evidence that parents have got in themselves from other experts that they want the local authority to consider that they may have not have had before. So that might be a good chance to say, well, let's try and resolve this without an appeal. Doesn't always work. It depends on the facts. Sometimes an appeal is necessary. I think it's a very high proportion of these appeals. It's something like 97% or something of these appeals actually are in parents' favour. So if you, that may have been updated, but that's the last figure I can remember anyway. It's very, very high. So if appeals do have to go ahead, a very good chance that actually the local authority will either concede or you will go all the way to a hearing and then the tribunal decides, well, of course there should be an assessment. Not always, obviously, it depends on the circumstance, but it's a very high proportion. So sometimes local authorities will just concede if you just lodge an appeal, for example. Sometimes that's enough just to show them that you mean business. And there's always the option to have discussions with local authorities, even if they've said no. There's nothing to stop parents going back and going, well, can we just, even not through mediation, it might just be a meeting to say, well, look, let's try and resolve this. We don't want to appeal. It's going to cost you time and money. It's going to cost us time and money. Let's just get on with this. But it always does depend on the facts. When parents come to us, we will always look at what they've either put in for a request or what the decision letter says, what evidence they've got. And we will say, you've got grounds to challenge this, or actually you should go away and maybe have a think about getting evidence for particular areas, or maybe actually there isn't that evidence there to show that an assessment is necessary. The child might be making good progress on what provision is available in school already. So it's always worth thinking about it. And I suppose remembering that you can always make new requests in the future. It's not necessarily the end of the line if they say no. Sometimes that can be an option to allow parents and schools a chance to go, right, well, let's gather more evidence and assess how things are going in 6 months, a year's time, potentially, and then go back and try it again. But I'd always say if you're not 100% sure what to do, then contact us for advice, contact specialist solicitors for advice, because it can potentially be a complicated area. So it's worth getting advice sooner. And like I said at the beginning, we offer free initial calls. There's no obligation if parents want to ring up just to get some initial advice from us. We can do that, just so you can work out what your options are and if you need help with it going forward.
Super. So thank you very much for that, Lydia. That was, as usual, very eye-opening and interesting. Janet, are there any questions in the chat?
There isn't at the moment, but actually I have one which is probably an obvious one, but is it dependent on each and each family as to how long the assessment takes, Lydia?
Oh, right. Okay. So the actual, no, I mean, there is also a time frame for that. So to give you a rough idea, if you make the request at week 1 for the assessment, local authority then has 6 weeks to decide. Like I say, they don't always decide within those 6 weeks. They should do, because it's a legal time frame, so you can hold them accountable if they don't. If you do that with the 6 weeks, then what needs to happen is, if they say yes at week 6, say, latest point, they then have to go out to the relevant professionals, educational psychologists, schools, all of them, and say, right, we're doing an assessment, you need to come back to us. They need to respond within 6 weeks of the local authority then contacting them. So that would then include getting the information from parents, all of those, anyone else. So again, keep an eye on timescales, because often timescales do go by and then it suddenly goes quiet. So it's worth noting that. And then by the point you then get to week 16, so week 1 is you make the request. Week 6 is when they decide yes or no. If they say yes, week 16, so it's another 10 weeks then from them agreeing to assess. That's at the point when the local authority needs to come back to parents or the young person and say, we've got all the information, we are going to either we've done the assessment, we can issue a plan or not, essentially. I'm giving like an overview here, but it's kind of helpful just to get an idea of overall timescales. Week 16 then, if you've then got a draft plan, you then have up to week 20, which is 4 more weeks for it to then be finalised. So in theory, you go from assessment request to a final plan, it should be 20 weeks maximum. The big bulk of that is the assessment phase. And then you then have this kind of, the latter end is then, if you have a draft plan, it's then the drafting and the responding to it and finalising. Obviously, that's not having any appeals at all. If local authority says no at any point, that takes you out of that timescale effectively. You sort of going to run along parallel to it, and you're then going in an appeal situation, which can be months, depending on what happens. It could be 2, 3, 4 months. You potentially then can have 3 appeals. They can say no at 3 different stages. So they could say no to assess in the first place, so at week 6. They could then do the assessment but say no to a plan, so that's week 16. Or you could get to week 20 and they've done all that and they say, here's a plan, but parents aren't happy with the content, and then they appeal. So it's worth preempting that it could potentially be 3 appeals. And then that obviously drags things out a lot longer than 20 weeks. It can then get a bit muddy in terms of when do they kind of go back into that 20-week timescale. If there's been an appeal, you have to jump around a little bit in terms of how long they then have to do the next step. But I suppose the key thing is, remember the 20 weeks. Again, the Code of Practice has a very good diagram of this. If people want to look at it, I'll put the link in the comments, because it's worth having that just as a kind of, pinned up on your wall if you need to, just so you know what should be happening and when. If they do miss any of the timescales, you should go back to them and say, this is ultimately going to prevent parents from appealing a decision if it's a no, or it's delaying getting this outcome. Yeah, in a nutshell, Janet.
Thank you, Lydia.
Very good.
Thank you. I have one from Karen. If the child is not known to social services, must they complete an assessment? And then who facilitates the mediation? Okay, so the social care one, so I will say it's social care rather than, this is where there can be a bit of, I don't know, confusion or kind of lack of understanding about what social care is compared to social services. Social services, my understanding of it, that's when you're saying that the child needs to be taken in, needs to be looked after by the local authority, or is at risk of harm. That's not saying the same thing that they have social care needs. Social care needs, if you think about ones like them being able to access the community, for example, if they can do it safely, or especially if they're a young person, can they go into the community and buy something from a shop, or can they safely travel somewhere? It's more that sort of thing. But going back to what the EHCNA needs assessment
requires, it is getting advice and information from social care. So really that is requiring social care umbrella of the local authority to say, okay, this is the information you have on this child. We need to provide some information about this child's social care needs, if any. Like I say, often they come back and say not known, and that is kind of left. And depending on the needs of the child, parents may say, well, that's fine, we're not too worried about that. The main point is the educational part. So what social care will just leave. But like I said, it does depend on the individual needs, because sometimes children do have clear social care needs that affect their independence, their ability to kind of access the community. And so sometimes it is necessary actually to say social care, no, I think my child, they definitely do have needs, but we need you to tell us. You actually do need to get involved now. Just because they haven't been known before, you now have to step up. But again, this is for the local authority to make sure this happens. And if they don't, sometimes it is an option that parents, will think, well, we'll get our own independent social worker to come in, because we are pretty confident that there is difficulties there, but they've never been referred to before, for this area of need. So I'd always say, see what social come back with, and then challenge them if you think, actually, no, there is something there. Saying not known is not sufficient, especially if we think there is needs there. So hopefully that's clarified things. The mediation, so that's separate from the local authority. Some local authorities will, for the purpose of an EHC needs appeal, so say if you make the request for the assessment and they say no and you want to go to mediation, it needs to be a mediation provider that is independent from the local authority. Some local authorities will have mediation kind of within their sort of remit, but it needs to be someone independent. It's often global mediation or kids. I believe they are normally the ones that crop up for EHCP appeals. So if parents want to mediate, they would contact the mediation provider that needs to be on the decision letter from the ELA. That's really important that they have the details on there. The mediation provider will then speak with parents or the young person. They'll explain about the options, and if they want to mediate, they'll put the request to the mediation provider, who will then contact the ELA. The local authority then has to respond. Well, they're meant to respond within 30 days and arrange the mediation. But if they don't, there doesn't appear to be any sort of sanctions on them if they don't do it. It's then said, well, we tried, they've said no, do you want to go back to them, or do you just want to go to an appeal? Here's your certificate, basically. So, yeah, it can be a good option if the local authority engages and if parents want to do that.
Okay. Do you have contact details of Global and Kids? You can search for them online. Those are the two main ones I've always come across that you see in these in local authority letters. If you want, I can. Yeah, if you, I think it is just global mediation. It's certainly global, but like I say, check that the details are on the decision letter from your local authority, because if they're not, they need to provide that, and details of how to appeal as well. So if anything like that's missing, then you would need to go back to them and say, well, I can't actually action my right of appeal because you haven't given me all the information. And it's also worth noting, just as an aside, if parents do go to mediation and then they subsequently have to go to an appeal, what's discussed in mediation can't be discussed in an appeal. It's completely separate and independent. So anything that's discussed in mediation is just kept within that one, that section. It's confidential. Obviously, if you come to an agreement in mediation, then an agreement is written up, and that kind of concludes the process. And you say, well, they're going to assess or whatever they're going to do. So it's worth just remembering that as well, that it doesn't prejudice you if you then have to go to an appeal because mediation didn't work, or they didn't sort out mediation within the time frame. So. Right, thanks. I did find just a link to that global mediation, which I've put up there.
Perfect. Yeah.
Thanks, Jen.
I think they do sort of say on the website about what their success rates are in the areas as well that they help people with. So if people are interested, it's worth having a look at. I'll see if I can find one for kids as well, because it's.
Oh, brilliant! Thank you.
Welcome.
I appear to have just lost my chat screen, but I don't think there were any more chats. Where has it gone? It's gone. Oh no, there's staring me in the face. So there's no more questions for you at the moment, Lydia.
That's all right. I think that's the first time.
We had so many last time.
I've called everyone and they've all just gone off for their lunch and just like
I'm sure that's not the case. I'm sure it's just because you were so thorough and you asked everything. So that's absolutely super. Thank you. So there's any questions? There's any question slide. So if anybody does have any questions, you can please do still put them in the chat, and because we will save the chat afterwards. And Lydia is very happy to be contacted. And what we will be doing, this is a recording. We will be recorded, and it will be posted up on our website. And we'll send everybody who has signed up for this a link to that if you wanted to have a look at it again or share it. And we'll put in the fact sheet as well. We'll put in any details that were covered here that may be of interest as well. So all of that information will be available. So if there are no other questions, thank you very much again, Lydia. That was really interesting. I have to say I didn't really know any of that information, so that was that was very interesting. And thank you for everybody for joining. I hope that was useful for you. There was a nice lot of people there who were watching. And Lydia has said that she will very kindly do another webinar for us in the future. And if anybody has any particular topics that they would like to ask Lydia if she could do a webinar on around, EHCPs, that's her area of specialism, please let us know or let Lydia know, and then she will consider that, and if she feels it is in her area of expertise, then we will organise a webinar in the near future to cover that subject. So please do let us know if there's something you particularly like to know about. And there are other webinars that are available on our website. And when we send out the link to the fact sheet, we'll also put the links to the other webinars, which are all about EHCPs, so that if you want to look at any of those, if you missed them.
I think there actually is a question.
I think there may be a question. I saw something just pop up there.
We're so excited. Can I just read it out for you, Lydia? Is that okay? Yeah. Once an EHCP has been issued, is it possible to request an EHCNA, or should all improvement be requested via the annual review?
Okay, so you can ask for a reassessment of needs once a plan has been issued. That's something that parents can ask for an annual review. So if you feel that the plan is out of date, or the child's got new difficulties that weren't there before, then parents or the young person can ask the local authority to do a reassessment, which then would be getting the information from all of the people that we talked about, as if it was the first time again, factoring in what information might already be available, any reports. So you can ask for that. If a local authority says no, you get a right of appeal as you would if they say no for the initial assessment request. Yeah, that is an option. Sometimes it's the best option to do. Sometimes you can get updated reports, or ask the local authority to get updated reports to help inform the content and an annual review. But yeah, you can ask for a reassessment. Oh, there's another question that's just come in. Do you want to read that one out too, Janet?
It is, what is the difference between an EHCP and an EHCNA?
And there's so many acronyms in this, isn't it?
I'm impressed that I could read it out.
Yeah. They're getting longer as well, Lydia.
We do, I know. So an EHCNA, that's Education, Health and Care Needs Assessment. So that's what we've been talking about today. That's the first step that has to happen in order to then get an EHCP, which is an Education, Health and Care Plan. So you have to have the assessment first in order to then decide if a plan is needed. Yeah, that's essentially it. There's a lot of it. They get called, EHC plans, assessments, EHC needs assessments. There's loads of ways of describing them. But I'd say if you want to know more about like the specifics between them, I'd say have a look at the Code of Practice. It's a very it's overall quite a helpful sort of guide. Chapter 9, I'm going to write that in the chat, is the one to look at for EHCP process. So that includes EHC needs assessments. That includes, you know, steps in between. It also has information in there about, you know, getting the provision and support from other areas like health and social care as well. So it's worth having a look at that. Also have a look at our fact sheets as well on our website, which I'll put in the chat as well. We've got fact sheets about the EHCP process. So if you want to know a bit more, just like in the condensed version, just to find specific topics, have a look at them as well. They're worth just bearing in mind.
Thank you, Lydia. And we do have one more question, and thank you from Janet, not me. It is a related question. After an annual review, should a revised EHCP be issued by the LA, even if there are no significant changes or amendments? That's a good question.
So after an annual review, the local authority has to decide if they're going to make any amendments to the plan. They may keep the plan as it is and maintain it, or they may say they're going to cease the plan and they're going to stop it. The ones you'll generally see is they're going to keep it the same, or they might issue proposed changes to the plan. So they don't have to issue an amended plan. They may keep it the same. And after either one of those options, so say if they keep the plan the same, or they issue, you get an amended plan that you've responded to with changes, or they say they're going to cease the plan, let's say, you get a right of appeal after all those options as well. So if you wanted them to make changes but they didn't, then you can obviously appeal. If they've made changes you're not happy with, you can appeal. Yeah, those are your options really.
Great. Oh, and thank you, Lydia, you've just popped up the code of practice. Brilliant. And no more questions.
Super, thank you. Super. So yes, I think we will wrap it up there. And thank you again for Lydia for all of that, and thank you for all of your questions. We will put together a fact sheet and email that out to you, and also let you know when it's online, so you can have a look at it again if you missed anything or you want to review it. And we'll also let you know about future webinars that Lydia is going to do. And as I say, if you have any subjects that you would really like Lydia to cover, please do let us know, and she will do her best to incorporate those if she can. So thank you again, and thank you very much for joining us, everybody, and we hope it was of interest to you. And we hope to, well, not actually see you because we don't see you, but we hope that you will join us again for some future webinars. Lovely, thank you very much, and thank you, Janet, for all of your your work letting everybody in and doing the chats. Super. Thanks very much, Lydia.
Okay, guys.
Okay, bye.